Hello, I'm Wendy Wilson, and I'd like to welcome you to another edition of Realizing Potential. Today I have with me in the studio colleagues here from Albany State University who were discussing a major issue that continues to impact Southwest Georgia. They want to share their role and how they are working to try to improve the health conditions of the constituents here. They are none other than Ms. Bassey and Mr. Canary. How are you today?
Good, and you?
Very good. Thank you so much for joining me.
And thank you for having us here.
It's my pleasure. It's my pleasure. Tell the viewers, respectively, a little bit about your roles here at Albany State University, what you do, and then we'll delve a little bit more into the grant and what you hope that will yield. I'll start with Ms. Bassey.
My name is Ann Bassey. I work for Albany State Project STOP. Project STOP means STOP, Student Taking on Prevention. I'm the project coordinator, prevention from HIV, HCV, and substance abuse. Basically, you know, what the grant, I just have to do all to talk about the grant because Project STOP is the grant. Basically, what we do is to help, reduce, the transmission of and the risk of HIV, HCV, and substance abuse on Albany State campus, Doherty County, and Terrell County. Okay. So we cover both the east and the west campuses, and then Doherty County, and then we go as far as Terrell County too.
Okay, very good. Mr. Canary, your role?
My role is project coordinator on the grant, and basically, like Ann said, that's what we do is help to reduce the incidence and transmission of HIV and STDs in Terrell County, Doherty County, and Albany State campus.
Okay.
And we have both community outreach and campus outreach.
Campus outreach. Now I'm curious, share with our viewers a little bit, educate us a little bit about the grant, the inception of that, the amount, if you will, who's the organization that's providing that? Either of you?
The grant is a federal grant, SAMHSA grant, and it was granted to Albany State in 2015. It's $750,000 for a 3-year period. Right now we are in the third year, quarter one, and it's actually on the criminal justice, and we have our program principal investigator as Dr. Thomas Judge. We have Dr. Sandra Anweck as a director, and Dr. Rani Judge as the grant evaluator.
Okay, very good. And you mentioned the three areas, geographical areas, certainly Albany State's campus, dealing with the students that work or that attend here, also Terrell and Doherty County. What does some of the program outreach entail? What type of activities? How do you go about educating individuals?
The grant has a restriction. It has an age restriction, they have to be from 18 to 24 years, but we go, above 24 years, because the 18 to 24 are our target audience.
Okay.
We've gone as far as going into the high schools, but their school county has been, so kind enough to let us come into their school, but we have to, take out the 18 years. We cannot talk to students below 18 years except they have a parental consent.
Okay.
A parental consent. So the 18 to 24 basically are major demographic, our target audience because they're the at-risk audience which the grant covers. So what we do is we go into classrooms. Yeah, we go into classrooms. We go into the communities. We go to the barber shop. We go into car wash. You can see us at the club, the liquor store. Every area we know we can, reach our target audience, which is 18 to 24 years. So we do programs, we do training. We have, like I said earlier, we go above 24 years because we have what we call train the trainee. So we can go to an organization and we have some partners. So we can train our partners and then they have a target a target population, and then they go ahead to train them too. So we call it train the trainee.
Okay.
We train them our programs. We have our evidence-based programs. We have the Sisters to Sisters. We have Safe in the City. We have PAMS. We have a new one coming in 2018 called 17 Days. So those are the programs we have right now. that, like I said, we go into classrooms, which has been a very successful one.
Excellent.
It's been, a very successful one. I'm going to talk about the program a bit because many of us don't know, how bad HIV, HCV, and substance abuse is, coming into Doherty County. Many of us believe, it's a small community, but actually big things are happening. From Dr. Jenkins from the Department of Health, there was an interview she did, and from WARB News, and she said that right now Doherty County rates number 2 for chlamydia from the 2015 statistic we have for Georgia, which is very bad, which brings me down to what a dental dam is. This is a dental dam. When we go into classrooms, we go into program, we can have an audience of about 100, and then I ask, okay, can you guys tell me what a dental dam is? And probably you won't believe 5 out of 50 or 3 out of 50 know what a dental dam is.
Sure.
A dental dam is like a mouth condom, is what you use when you're having oral sex or anal sex, because many of us engage in oral sex and anal sex without protection. And so if, say for instance, if I've got an STD and then you engage in oral sex or anal sex with me without using a dental dam, you put yourself at risk.
Exposure.
Exactly. Yes, many of them know what a condom is. We've gone to programs where we have condom demonstration. We notice many people have been putting on condom the wrong way all the time. So we also teach condom demonstration.
Excellent.
We teach them the different kinds of condom. We have different kinds of condom, different kinds of sizes. There's a slogan I have, and I said, every guy wants a Magnum, but not all guys are Magnum. So if you want a big size and then you're not a Magnum size, the effect of using a condom is forfeited.
Right. So you talk about, and certainly all of those elements that you mentioned are certainly important and critical in terms of educating individuals. And I'm sure you always are both surprised in terms of the level of naivete or lack of understanding that people have. And you should be informed whatever activity you decide to engage in. But let's share. To me, and I'm sure there's some other individuals that feel the same way. It's something about data and statistics that are very sobering to people, and that's when it's almost like you're ringing the alarm in terms of the impact or the devastation that risky behavior can have. So you mentioned the high incidence of chlamydia in this area. I noticed that you also shared that you target a population of 18 to 24. Why that population? Why that age group?
Like I said, this is a federal grant, and when the grant was advertised, it's an MSI CBO. MSI means Minority Serving Institution. That's what the grant covers, and what they want us to cover is for 18 to 24 years.
Okay. So that's already defined for you. And where I was going with that, I didn't know if that is if you have a high incidence of HIV and the other areas that you mentioned, drug abuse, if they fall within those parameters. And maybe that's what the research dictated.
I'll quote from CDC, from the statistics we have in CDC, from the 2015 statistics we have. It says that from the 2015 diagnosis they had, 1 out of every 5 falls between 13 years to 24 years.
My goodness. Right.
So you see, they are the one would expect the older adults to be more, but we have young adults and younger adults these days engaging in sex, without knowledge, without the understanding, and some of them does not really know the repercussion of what certain actions are. So that's why 18 to 24, we have the young adults. Yes, you should not be doing this before a certain age, but if you must, you need to know these are the rules, these are the things I need to do.
Necessary precautions.
Yes,
that
so
you need to
18 to 24, we believe if we can target those audience, by the time they get above those age, they are more knowledgeable in those areas and more informed.
Excellent. Mr. Canary, tell us, the viewers, I know you all are promoting World AIDS Day.
Yes.
Tell us a little bit about what activities you all have designed and will prepare to implement in association with that.
Well, we have free testing, confidential testing. We have free screenings, and we have collaborate with our partners, community partners, and we, we do events and things like that. Both on the basically that's what we do is we try to promote awareness, practicing safe sex, getting tested. And we have events coming up. We have an event on November the 29th.
Okay.
That's going to be on the East Campus from 10 to 1 p.m. And on the West Campus on December the 1st from 10 to 1 p.m. As well. And we do activities. We give free giveaways and things like that. So it's quite a nice time. You're getting educated and getting informed at the same time.
Very good. So now, will students on either of the campuses that they frequent or happen to be on that day, if I come to your table, what can I expect, or to the location? And we'll need to share the I don't know if you have the specific location for each of the respective campuses, but will testing actually occur that day?
Yes, testing, because testing usually takes about 5 minutes.
Okay.
So it's not like, you get the test, you do the test, probably go around the vendor tables, and by the time you go around the vendor tables, yeah, we have some vendors. We have Network of Trust. We have Department of Health will be doing the testing. We have Open Arms and some other vendors, that will be on ground that day. For the East Campus, is going to be at the Student Ballroom.
Yes.
It's going to be the Student Ballroom from 10 to 1 p.m. Like you said, you said, what do you expect when you come to a table? If you come to the Project Stop table, of course, we have free giveaways. We have different kinds of condom. But there are some things we do. We don't just give out the condoms. We try to, test your knowledge. We test, yes, we test your knowledge. We can, put different kinds of condom on the table and said, okay, can you tell me what this is? Can you tell me what this does? That way they know the resources and the types of condom available out there. Okay, can I use a lubricant? Can I use, people use Vaseline, which you're not supposed to use as a lube. So those are the things we have. Yes, we have a female condom, which many people are not quite, aware of, because some male don't want to use, but some females are like, oh, yeah, I want to try what a female condom looks like, And we just basically test you and said, okay, we have models. Can you put on a condom correctly? Okay. We have, we talked about substance abuse. We have the drunk glass. We have different level of the drunk glass. So we make, student put on the drunk glass and then put on a condom on a penis model to see, okay, what if I'm drunk and I want to have sexual intercourse? Will I be able to put on a condom the right way or the wrong way?
Sure.
And you'll be surprised,
Absolutely. Because you're under the influence.
Exactly.
So yes. You said something I thought was interesting before we wrap up, and I want to go to those dates again. And I think it's important to discuss the evolution of testing, because 20 years ago when they started, and I'm sure it predates back then, but when there was heavy discussion and education about AIDS and prevention and awareness and HIV and what the testing involves, it would certainly blood sample, and then it would go off and it would have to be tested, and you would have to wait, a period of time. And so did I hear you say that someone can come, get tested, and then 5 minutes later?
Yeah, because we do the swab.
The swab. So again, the evolution is not
blood.
Just it's no okay.
Yeah, but it's improved over time.
Sure.
Even the blood, they still have the ones, so I'm like, oh, I'm so scared, I don't want to go.
Right.
The needles and all that. For some people that do the blood, what they just do is just to poke your thumb.
Okay.
And then it's not like drawing of blood, but the testing we'll be doing, which is going to be the swab.
Wow.
Yeah, so with the swab, you get the result in less than 5 minutes.
That's amazing. That's amazing. What I love about that is then we're eliminating all excuses.
Yes.
As to why you should not be tested and informed. People are, if you do find that you are positive, people are living healthy lives, HIV positive, and of course having to make some adjustments in terms of their lifestyle and
I like to add, when we do programs, we try to ask people for questions.
Okay.
We just want them to ponder on those questions, and we ask, how sexually active have you been in the last 6 months? Have you used protection in the last 6 months? How many sexual partners have you had in the last 6 months? And have you been tested in the last 6 months? You know, those are questions we have. We don't, you know, we don't ask them to tell us the answer, but those are the questions we ask for them to ponder on and said, okay, have I been doing this? What next action do I need to do?
Sure.
So basically what we're saying is, we're not saying, you know, stop having sex. Abstinence is the best way, but if you must have sex, use a protection
precautions, sure.
and always get tested.
Okay.
So, you know, people feel HIV tests, okay, once I'm HIV negative, that's it. No, you might be HIV negative but have some STDs. So we encourage people to have both HIV testing and STD testing at the same time.
Excellent, excellent. And so will that be offered too?
We only be
just doing the HIV
because it's World AIDS Day.
I gotcha. Okay, okay. Just wanted to clarify. So World AIDS Day is
for the East Campus in Albany State. It's going to be November 29th, the student ballroom from 10 to 1. And December 1st is going to be at the West Campus from 10 to 1. The vendors are going to be in the student center lobby.
Okay.
But the actual testing would take place in the student health.
Okay, very good. And Mr. Canary, are there any numbers if I'm a student or I just want to learn more about it or I want to invite Albany State to come out and speak to a community-based organization? Is there contact information that you can share?
Yes, I have my office phone number, which is 229-430-7898.
Okay.
That's my office number, and my email is kenneth.connery@asurams.edu.
Okay. And I just volunteered you all, but it sounds like you all do go out and meet with the respective communities.
We do go out, and we want to use this medium to reach out to, you know, many of us in the community. We haven't, you know, reached, you know, the number we're reaching, but we want to do more.
Expand
you
that,
know,
sure.
we want to expand. If you have, you know, your group, your organization, you know, our target audience, our major concern right now is the faith-based community. It's been very difficult to break through. It's been very difficult to break through. We just want to plead with them, you know. Let's talk to your kids, you know, let's talk to you. You can talk to your kids. You can, you know, talk to our target audiences, you know, if you don't want us to talk to them. But there's a lot, you know, we need to inform them about because we know some of us go behind to do those things. But if you're going to do it, we want you to do it the right way.
Yes, I agree. Yes, that appeal needs to continue to be made. We cannot exist with blinders on and so again, and I'm sure that's what the faith-based community preaches. And the literal sense is that you should abstain. But we know that is in fact not happening. Thus, the high rates of HIV and pregnancies and you know, other sexually transmitted disease. So the activity is certainly still taking place.
Yes.
Right.
So and we want to also have that, you know, from the inception of the grant, we've given out over 70,000 condoms.
Excellent.
Yes. Over 70,000 condoms, and we have our condom bowls in, you know, strategic places. We don't want, you know, to hear excuses. Oh, I can reach.
Sure.
You know, some of our teenagers, you know, those that are sexually active, are either, you know, scared or shy, you know, to go out to get condoms. So, like Kenneth gave out his number. My number is 229-430-3815, and we are located in the New Fine Arts Building. So I've seen many students, I've seen people in the community. We have, you know, our condom bowls in the car wash. We have them as far as Terrell County, you know, where we have condom bowls and people can actually know, you know, they can go to those places and get, you know, a bag of condom.
Excellent.
You know, so that's not an excuse.
You're eliminating the excuses, and that's all a part of empowering and educating individuals. So, yeah, very good, very good. Well, it's a pleasure having you both on there.
Thanks for having us.
Excited about this grant, and I know you will continue to make a huge impact. That is the goal, and so we'll certainly speak
together.
That into
we
existence.
do it together.
Absolutely,
it's a joint effort.
It must be.
Effort,
It must be. Absolutely. So again, those dates on the campuses. The East Campus is when?
November 29th.
Okay, coming
10
up.
to 1, Student Center. That's the Student Center Ballroom. And December 1st, the West Campus, the Student Center, and the Student Health.
Okay, very good. Thank you so much. Enjoyed having you both on the show today.
Thank you.
Viewers, thank you so much for joining me for this edition of Realizing Potential. I'm Wendy Wilson, and I will see you next time.